KC San Antonio Living. If you've got varicose veins or spider veins, this is the perfect time to get rid of them. And this morning, we're going to tell you how easy it is. Joining us this morning from Vein Tech Vein Clinics, Dr. Robert Thompson. Also, Jenny Flipsy. She has had this procedure done, and she's smiling, very happy about the way things look now. It's nice to see you both. Thank you for coming.
Thank you.
Welcome. A lot of people hear, getting rid of their varicose veins, their spider veins, and they freak out because a long time ago, it used to be a not fun treatment, but things have greatly changed.
Yes, they have. We have new chemicals now that we inject the spider veins with. They go away quicker, it's less painful, and you can get more treatments at one time without having to come back and forth several times to the doctor.
And the thing about varicose veins, not only are they not pretty, but they're also a health hazard.
If they get larger beyond the spider vein stage to true varicose veins, you can have bleeding, you can have a lot of pain, and at worst stage, you can get sores on your legs.
Wow. So, Jenny, why did you go in? What were you dealing with?
Well, varicose veins are hereditary in my family, and so I watched my mother and my grandmothers deal with them. And I've had two of the original kind of vein surgeries, the strippings.
You did.
And when I heard of Dr. Thompson, I'm a runner, and I stand a lot at where I work, and my legs would be sore.
Yeah.
Plus, they are unsightly, but they would be sore at night. And so originally I went just to help relieve that.
What was the difference between the way things are now and the way they were years ago?
Night and day.
Yeah.
I've had two of the strippings done. And so, of course, I was in the hospital with anesthesia, and the recovery was long and a lot of wrapping. And when I go to Dr. Thompson, usually I go on a Friday, and since I run, usually by Sunday I would be running again.
Wow,
and
that's fast.
and it would feel good, and I would go back and get them checked, and they looked good, and so I had really good results with that. Just the speed of it was really nice.
A lot of people are in your same position where even at a young age, I've seen girls my age with big varicose veins because it's hereditary. We've got some pictures to show you just so you can kind of know what we're talking about, and these are definitely amazing, the transformations that we're seeing here.
Yeah, and these can all be taken care of usually in a couple of treatments.
Wow. Can you, I can't imagine letting it go that far because it seems so painful. How many treatments does it take to go from something like what we're seeing on the left to something on the right?
You can, depending on whether you need the larger tributary veins treated first, that's the first procedure, and then usually one or two secondary procedures.
Okay.
So probably a month period.
Wow,
total.
That's amazing. And so you do it now, you're going to be ready for summer. I think that's the best idea.
Yeah.
Let's talk about spider veins, because I know those are more common. I mean, I have spider veins. I'm not happy about them. How do you get rid of them?
Well, most of those are heredity.
Okay. Thanks, Mom.
So if your mom had it, they're not a health risk, but they do bug people. And then during hormonal stages, they do itch and burn sometimes. But those are all treated with injections, different kinds of chemical that goes kind of like a TB skin test.
Okay.
Small needle that goes in the vein, and the vein basically swells and scars itself down, so the blood goes out of the vein, and you don't see the vein anymore.
Wow.
We do those at half-hour sessions and come back 2 or 3 times to get a larger treatment. It's gone.
We've got some pictures too of some spider veins to show you how successful you can be with the removal of the spider veins. That's a huge difference.
Yeah, the newer chemicals are much better and they're less painful, and it brings a lot of people into the clinic.
Wow. What about insurance? Does insurance cover some of these procedures?
Insurance will cover the larger treatments that are having symptoms, and if you've not get any results to the conservative treatments like compression stockings and exercise and things like that.
What about guys? Do guys deal with varicose veins too?
I see about 20% men.
Really?
They tend to come in later because they don't want to come in, or their wives bring them in. But they tend to be pretty large when they do come in.
Yeah.
But we can do all sites of veins.
Jenny, what would you tell our viewers who are at home and they looked at some of those pictures and they go, ugh, I have that. I need to get rid of it.
Well, I think the thing that it really is so amazing, and it's not painful enough to not do it.
Right.
And I think the health benefits of just having your legs not hurt and feeling like you can wear shorts and a skirt again, it's definitely worth it.
Well, thank you both for coming today. I do have a very special offer. Thank you so much for doing this for San Antonio Living viewers. If you're ready to find out more about what they do over at Vein Tech, Varicose Vein Clinics, for the first $10, we will give you $50 off a full spider vein treatment. Again, for the first 10 callers, $50 off a full spider vein treatment. And Jenny says that's a great deal. So here's the information. Give them a call. Vein Tech Varicose Vein Clinics. There are 2 locations in San Antonio. Go to veintech.com or call the number that you see on your screen for details, 483-8822, for more information. And don't go away. We've got more San Antonio Living coming up next.